to the coronavirus, and certainly, the phone calls that we've had already from Hong Kong, from Beijing, show there is real fear in China. My next caller is a doctor who's calling from Hounslow, and it's Kadiyali. Good morning to you.
Good morning, Nigel. My name is Dr. Kadiyali Srivatsa. I am an author, doctor, and a publisher of an app called Dr. Maya. This app helps you to differentiate between common and serious illness. This also helps you to identify individuals infected with coronavirus so that they can be isolated at home and prevented from going to hospitals, clinics, or to the town center spreading their infection.
Welcome. As a doctor, what is your perspective on this coronavirus?
This coronavirus is not a virulent one. At the moment, very mild. Whether it is going to change the structure and then become more virulent is very difficult to say at present. I'm a doctor who's been talking about superbug pandemic since 1989. It's not the virus I'm worried about. The bacterial infection follows virus, and that is the most dangerous one because we are running out of antibiotics. Putting all these patients who are positive into one hospital ward. They should be isolated in each cubicle. If not, secondary bacterial infection will spread, making them sicker, needing ventilation, and that's going to be a major problem. And that's why I come to you, because I have methods in which people can learn and they can also identify infection instead of rushing to the hospital. The other major problem I'm concerned about is cross-infection. In other words, if a person who has some other virus walks into a hospital, goes to surgery or a clinic, will get infected from people who are waiting in the room. And that is going to increase the number of patients getting coronavirus infection in the town, country, and spread all around the world. So the most important thing is to prevent people getting out of the house with the symptom.
And that, to some extent, is what the Chinese government are trying to do, isn't it? They're
Yes.
people. They're quarantining them. But what happens when food runs out?
This is not my major concern at the moment because it's just the beginning. This is not a major problem at the moment. But people have to think about organizing and they'll have to take risk when they go out. So that's why I'm saying a person who's infected must be isolated in the house, not allowed to go out into the town, travel, and go to the hospital. But by the way the government is working, is putting posters and banners, it's not going to work. People are not going to see. So that's why I created an app where you should insist on people using the app first. If the app says go to the hospital, then go to the hospital. Otherwise, it will give you an option to make a phone call, speak to the doctor, and reassure them, do this, stay at home. If one person comes out of the house, go to the hospital, he'll infect 824 people on the way. And if he comes to see the doctor, because 3 healthcare workers will get infected. So what the hell are we doing? We are just allowing people to move around like headless chickens. Somebody has to put the foot down and say, that's enough, use the app. I've created websites where they can just put in the symptoms and they will possibly, I cannot be 100% sure that they have coronavirus, but it's only based on symptoms.
Okay. That's very interesting. Thank you very much indeed for that. Well, that's the point being made.
Thank you.
Bye-bye.